Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University. And I'm pleased to provide the Public Health Weekly Update, number 132, with data accurate through November 22nd, 2022. I'm going to start by wishing all of you a very happy Thanksgiving holiday. I am personally very thankful for all of you who care enough to try to get the most up-to-date information that you can and sharing your desires, your thoughts, your concerns with me over the last couple of years. Today, I'm going to do a quick infectious disease update, specifically a 1-minute update on COVID, monkeypox, Ebola virus, seasonal flu, respiratory syncytial virus. All of those I talked about a couple of weeks ago, but I'm going to add measles as well. In terms of COVID-19, we've been watching the number of daily deaths, and we can see that for about 7 or 8 months, the number has stayed remarkably stable. We haven't seen the spikes we've seen in the past, but remember, the spikes were typically in January and February. So hopefully we won't see anything like that coming up. And at this point, we're not seeing it. If we look at the early marker for deaths, that's hospitalizations, you can sort of see a relationship. We're also not seeing a particular increase in hospitalizations right now. Now, that doesn't mean we're out of the woods yet, because in fact, we're still seeing 300 deaths a day, 3,000 hospital admissions every day. And according to the CDC, COVID remains the third leading cause of death in the United States. I'm not sure that that's accurate, but we have to go with it for now. And they continue to point out that vaccination and boosting is the best protection that we have. If you look at this was from March to September. You can see the rate of death for unvaccinated was so much higher than those who were vaccinated, and especially those who had a primary series and 2 booster shots. So COVID remains a significant public health problem for us. Fortunately, monkeypox seems to be slowing down, 80,000 cases. 79, almost virtually all of them in countries that have not historically had monkeypox, 55 deaths. About a third of all the cases that have been recognized have been in the United States, including 14 deaths. Fortunately, the spike that we saw in the daily number of cases has been coming down, not gone yet, not quite ready to take it off the list, but it's certainly moving in the right direction. We've talked about the Ebola outbreak in Uganda. As of now, there's 141 cases. A little over a third of them have died. 19 are healthcare workers. And at this point, I have not seen any confirmed cases outside of Uganda, at least associated with this particular outbreak. And if you look at the daily number of cases, it seems to be down and staying down, but still not gone away. So hopefully this will slow itself down, but it's a significant outbreak. Seasonal flu is something we always pay attention to this time of year. It's elevated across the country. The CDC reports probably 4 million cases of flu, 38,000 hospitalizations, 2,000 deaths. And here, if you want to pause it, you can look at this. These are the hospital outpatient visits for respiratory illness over the past few years. And what you can see is we are not only seeing an earlier rise, but it looks perhaps to be even steeper than previous years. So we'll keep our eye on that. In terms of where the cases are right now, it's largely here in the Southeast, but there are cases in other parts of the country as well. We've talked about respiratory syncytial virus. When I didn't go into a great deal of detail about how serious it is. According to the CDC, each year, RSV leads to about 2 million outpatient visits among children, somewhere between 60 and 80,000 hospitalizations in young children, 60 to 120,000 among those 65 and older, a significant number of deaths among the elderly, and 100 to 300 deaths among the young folks. This is a very serious disease. And unfortunately, what we're seeing this year is both early and higher numbers. This is a very atypical year, and we simply don't know whether that downward trend is going to continue or whether this is going to be a really serious disease. And one of the problems now we're seeing is that hospitals are reporting that they're being overwhelmed by cases of RSV. Children's Hospital Association and the American Academy of Pediatrics are pointing out unprecedented levels at the risk of the breaking point for some hospitals, and infants 6 months and younger are getting hospitalized with RSV at a rate 7 times that before COVID. So certainly a very significant outbreak. Now, measles is one we haven't talked about recently. It's obviously a highly contagious disease. It spreads from person to person through the air and on surfaces. You touch the surface, you touch your eyes or nose. It's so infectious that about 90% of unvaccinated people who are exposed will develop the disease. The disease has an incubation period of about 10 days to 14 days. Then it starts with nonspecific findings, fever, cough, runny nose, inflamed eyes, and so on. Then you get this head to toe rash, meaning it starts in the head and goes down to the body. Unfortunately, the problem with measles is there are some pretty significant complications. Diarrhea and ear infections are quite common. Pneumonia and encephalitis and the long-term complications like subsclerosing panencephalitis are very serious. And about 1 to 3 out of every 1,000 kids who gets measles will die. Globally, 130,000 people die from measles every year, mostly young folks and pregnant women. According to the World Health Organization, in the first 2 decades of the 21st century, 23 million deaths have been prevented by the measles vaccine. It's an incredibly effective vaccine. Unfortunately, in the United States, about 1 out of every 10 kids has not been vaccinated against measles. And not surprisingly, there's now an outbreak of measles among unvaccinated kids in Ohio. I haven't had data this week, but as of last Friday, 19 cases from 10 daycare centers and 2 schools, and 9 children are hospitalized. So as always, it's really important for us to pay attention to the evolving infectious diseases so that we know what, if anything, we need to do to protect ourselves. If you have any questions about these issues or any others, please let me know. There's a great deal more information on the College of Public Health website. Particularly, we have now posted all of our previous weekly updates, all the topics we've covered, including but not limited to COVID. And if you know anyone who's interested in these videos, please please share it with them. And if they'd like to be added to the mailing list, we're happy to do that. As always, I'd like to thank Dara Young for editing, producing, adding captions, and posting this video. And most importantly, I want to thank you for your questions. If you have any questions about what I've talked about this week or any other evolving public health issue, please let me know. I look forward to hearing from you. Until next week, I hope you have a wonderful Thanksgiving holiday, and please be well.